Curry for being here. Also want to recognize Representatives Byrd and Fisher. I didn't see Duggan. Is he here too? I did see Cord and Jason, and obviously the officers that are here with us. We, last legislative session, we wanted to do something to recognize the people who wear the uniform and put themselves in harm's way. And while there were efforts in other states and communities across the country to defund law enforcement, we said we're going to be funding law enforcement and then some. And so I proposed $1,000 bonuses for every sworn law enforcement officer in the state of Florida, as well as fire, EMTs, all our first responders that had did so much over the previous year. And we were happy that the legislature concurred in that and that we passed it and signed it in the law and the budget in June. And it took a little time for Dane to get all the stuff ready, but we have checks now, and so we're going to be handing some out today, and then we'll also be mailing a lot out to other places throughout the country, or throughout the state. But we'll have almost 50,000 sworn law enforcement officers across the state will be receiving a $1,000 bonus. We also have many fire. I was just down in Surfside. We were able to give checks out to Task Force 1 and 2, which are both based in Miami-Dade and were instrumental in the response for the Surfside tragedy that happened in June, and really has left a deep hole in our hearts to this day. But they were there, and they saved a lot of people in those early hours, and then they searched nonstop through that rubble day after day, and it was such a bad collapse that I think realistically, in hindsight, there probably wasn't any opportunity, but they were not deterred. They did whatever they could to try to save folks. So we appreciate what they did, our fire. And of course, our police, it's just the type of thing where it's sometimes fashionable to knock the police. Some people try to make political points by criticizing the police. We've heard about defunding. We've heard about this or that. But let me tell you something. When there's something that goes wrong and someone's in jeopardy, they need people in uniform to come help. And it's usually the people who are the most vulnerable members of our society that are the ones that the men and women in law enforcement are usually called upon to serve and protect. And so we appreciate what the men and women of law enforcement do in the state of Florida. As governor, I do, but I think also as the legislature showed, they do as well. And you saw a lot of difficult circumstances over the past year and a half for police officers, and I think folks here at JSO and throughout the state of Florida, they stood strong, they served, and they made a real difference. We have some here who I'll particularly recognize. We have with us Police Officer Jack Chu. He's an Army Reserve veteran. He served in Kuwait and Iraq in 2004, has had a 25-year career with JSO, and he's happy to be back at work after recently undergoing a double bypass procedure. So I'm proud that we'll be able to show him appreciation for his service in law enforcement with a check today. Also, we have Police Officer Darvin Ruiz, a single father to an 11-year-old son. He's not only a dedicated dad, but is honored to work daily to protect his community. He steps up day in and day out, and so we appreciate him as well. So we made the promise that we were going to do the $1,000. We worked hard in the legislature to get it. I was able to sign it in June, and now we're delivering them in person here today. Do we want to give the, Dane, do you have the, for the first two?
Yes, sir.
Okay, so where's Jack?
Right here, sir.
All right, come here.
Yes, sir. Thanks, sir.
Photo. You guys got it? Yeah. All right.
Thanks, sir.
All right. Darvin, congratulations. Thanks so much. All right. Appreciate you. Okay, well, we're blessed to be joined by our wonderful First Lady and our rambunctious little 4-year-old Madison. So the floor is yours.
Well, I wanted to make sure that we came out and just said how much we are appreciative of our law enforcement for what you do to serve and protect. We're forever grateful for the sacrifices that you make protecting the community. And earlier today we were meeting with first responders, and I just have to say there's a really cute story. So the governor's mansion, where we are very blessed to live, it's about 4 or 5 blocks away from a fire station, and so the kids and I on occasion will walk down there and we'll go visit with the firefighters. And we'll go sometimes bring cookies, sometimes they eat more cookies than we give out, and that's another story when it gets to sugar highs. But other than that, we go and we say thank you to them, and we get to see them. And so now we've developed kind of a relationship. So every time we see the firefighters coming by in their trucks and the sirens are blaring, the kids go, oh, they're our fighters' friends, to the rescue. And they recognize, and they're so appreciative, even though they're 4, 3, and 16 months, they get so excited when they hear those sirens. And so we really thought it was important to be here just to say thank you for those sacrifices that we know that you make day in and day out. And also, it doesn't come without a toll, because I would say, a lot of folks are serving. You're putting the needs of other people above yourself, and that doesn't come with a toll in the form of an emotional and mental toll. So that's why we're really looking at opportunities when it comes to the federal block grants that we've gotten from SAMHSA. We're working with DCF to see how we can work with our legislative partners to see if we can use those funds to best support the emotional needs of our first responders and our police. Because oftentimes there's some folks that are suffering, but they do so in silence. And I think really having those resources to show that there is a peer component, that there are people that they can reach out to and be able to confide in, I think will do a lot to give back to a community that has given so much. So thank you for your service.
Okay, Mayor?
Well, Governor, it's good to have you, the First Lady, and this princess in Jacksonville today. So on behalf of all of our residents, welcome back to Jacksonville. Governor, I just can't tell you how much this means. When I first ran for office, I started in 2014. What I heard from members of law enforcement, all public safety, Steve Zona, Randy Reeves, representing them, was that not only had they not had pay raises, they had pay cuts, benefit cuts, and morale was in a tough spot because of that. We've collectively worked together as a community to negotiate in the last 2 negotiations raises, but it sends a tremendous message when the leader of our state, the executive of our state, steps up with the members of the legislature and does this. So thank you, Governor, and thank you for all that you do.
All right. Dane Eagle?
Well, I'll be brief, but I wanted to thank the governor, the First Lady, the First Family, really, for making this a priority, honoring our first responders, and especially Madison here, future governor, as I mentioned at the next stop. If she wants to be, I'm sure she would do an amazing job. But the governor has prioritized this, and we at DEO, Department of Economic Opportunity, we were in charge of facilitating it and making sure that it was done in a timely manner. We had to work with the 400 plus cities, the 67 counties, and really facilitate hundreds of thousands of checks getting out across the state. The governor wanted to focus on a few areas, and we're here in Jacksonville and Northeast Florida to highlight the cream of the crop and what they have done over the course of COVID. So without further ado, again, thank you to the governor, the legislature for prioritizing this and meeting the governor's needs. As I read names, we'll ask you to come up. The governor will hand you a check. We're good here, and the undersheriff will help and assist with that. So we will get started. First up, Lieutenant Daniel Adams. Officer Russ Aschenfelder. Sergeant Harvey Baker. Officer T.A. Blum. Assistant Chief Ellis Burns. Assistant Chief Lakeisha Burton. Officer Jack Chu.
Already got it.
Oh, Officer Cassandra Clinton. Officer E.B. Coffey. Officer Rolaska Hoover. Officer Gregory Howard. Officer Richard Jones. Assistant Chief Brian Key. Officer Sylvia Mitchell. Sergeant Daniel Funenstein. Officer Melissa Quinn. Assistant Chief Jennifer Short. Lieutenant J.D. Stronko. Officer Timothy Terrell.
Governor, you got it. It's a pleasure, sir. Thank you.
Lieutenant Joel Vandelinder. Officer Austin Votour. Assistant Chief Craig Waldrop. Chief Thomas Waters. Lieutenant Erica Weber.
And the rest are hopefully in the mail, right, Dave? Yes, sir. Okay. So they'll be over probably this week and next week. People will have almost 50,000 sworn law enforcement officers getting them, many thousands more fire and EMT. And, you know, he did have to do a lot of work on this because it's not like the state just has, we have every law enforcement, EMT, first responder, and like a separate data. We had to really get the information from all. So they worked really hard to do that. And I told them, I said, when we signed the budget in June, I said, look, I want to get this out in due time. I don't want this to take 6 months. So they were able to work hard and get it in a good working order. So thanks to the men and women of JSO. We're here for you. This is the least we could do. I think it was very appropriate, and we're glad that we're able to, to help. And with that, I can take a couple questions.
Governor DeSantis, there are 300 respirators the state has requested from the federal government. First, what is the plan for those? And secondly, on that note, regardless of state or federal numbers, COVID cases continue to climb, especially in Duval County. At what point is it time to change?
Well, I think I would correct you on that. The 7-day average for Duval County is decreased 18% since July 31st. The emergency room visits in Duval County for COVID-like illnesses over the past week have decreased by 14%. And then if you look at the RT value, which is the reproductive value, that's now 0.83 in Duval, which means you're likely to see decline. So those are all the leading indicators in terms of what you're looking at. And I think that fits with these cycles typically go 6 to 8 weeks. Duval in Northeast Florida started rising before other parts of the state. And so I seeing that nose over. If those trends are durable, you will absolutely see the hospital census reflect that for sure. And I think we're seeing in other parts of the state as well a flattening. I think South Florida, now they don't have as intense an outbreak as they did last summer, but I think they're probably a week and a half. And so we're happy with seeing those trends, and we think that they'll likely to continue doing that. Jim.
A lot of people disagree with that. I just left the hospitals. I left the testing sites. We had 24 people die at one hospital since the first of the month. Doctors are telling me it is only getting worse here, and I'm hearing that from a number of people. And they say when they say that they are lambasted because they're telling people that.
No, well, look, I think the hospital. So these indicators I just talked about, 7-day average cases, COVID-like illness, ED visits, RT value, those are leading indicators that will later be reflected in the hospital census. And so if you have a decline in ED visits or cases, you're not necessarily going to see an immediate decline in the hospital census. It usually takes about 7 to 10 days to be able to do. But those are the figures. I mean, we track it very carefully. Clearly, though, if you look, last summer we had a summer wave, but it was really 40 to 50% of it was confined in southern Florida. Duval dealt with it. Other places dealt with it. but not to the extent this year. And so then this year, South Florida, a lot of those didn't reach their numbers from last summer. But then you have places like here in Northeast Florida, which has exceeded the numbers from last year. I can tell you, though, having talked with folks up and down the state with the hospitals, the Seniors First strategy we did on vaccinations has paid off. They are not seeing the same type of patients they saw last summer when they had nursing home outbreaks. They had a lot of senior citizens going in. We have 85, 90% of seniors have been vaccinated, and 80% of 50 and up, have been vaccinated, and they are not seeing a lot of hospitalizations and ICU admissions with that. So that's something that I think the lesson is, I think that Seniors First was right, that these vaccines are preventing severe illness, helping keep you out of the hospital. I think one thing that we can't say is that the vaccines are creating herd immunity. I think there's a lot of people that have tested positive who've been fully vaccinated. The protection you get from that is not what we thought it would be. But the good news is that when you do test positive, it's usually like a cold almost. And so it is reducing severity. It's not keeping you from testing positive. Why does that matter? Well, because if all the people that were vaccinated couldn't get it or transmit it, then you would have a much, much less way for this thing to spread. So we know that, and it's just something that you're going to have to deal with.
Back to Chip's point, what do you say to these doctors who are at their wits' end in these hospitals?
In terms of what?
They're at their wits' end, they say they don't have the resources, they're overwhelmed.
Well, so I would push back on that too. We're in contact, our ACA secretary, in fact, she's met with all the hospitals here.
Why are you asking for 300 respirators?
I didn't ask, I don't know, I did not know about that, so I've not heard about that, so I have to check to see whether that's true or not. I would honestly doubt that that's true, but I'll look, because we have a lot of stuff that we stockpiled over the last year and a half through the Department of Emergency Management. I've not had any requests across my desk. I've not been notified of that. But they are in contact with the hospitals. I'm personally in contact with CEOs of a lot of the major hospitals. I'm in contact with the mayor to the extent. Well, right. So I get that. But if you're saying that there's not resources, the way you would do that is a hospital would then ask, and we ask, what do you need? What do you need? And there hasn't been requests. The one thing that some of them had was the way that some of the companies were transporting some of the oxygen. They were not doing it. They thought that they were falling behind. Our DEM, we dealt with that, and we redid it. But, this is a lot different than March of 2020. There's been a year and a half to be able to get the resources you need, be able to stockpile different things. Obviously, we have more options in terms of dealing with folks. One of the things I think that's just been absolutely unforgivable with this whole thing is that a lot of people still don't know about monoclonal antibody treatment. That should be the number one thing that you hear from all these folks that are always going on TV and always harping about different stuff. Excuse me?
Not vaccines?
Well, we've done that. I mean, that was, we've done a lot on that. But I'm just saying, like, when you have a wave, if you're dealing with a wave and you get infected, people should know, especially if they're high risk, that they should early go to the doctor and try to see if this would help them. Because when they do it early, it works. The data is very strong, people that do it, but a lot of people don't even know about it. And so how would you be in a situation where our most effective defense to an infection, again, this is when you're already infected, that's not something that people understand. So we've tried to spread the word about it the best we can in the state of Florida, but I really think that this is something that should be talked more about nationally, because look, at the end of the day, the vaccinated folks we know can get infected. It's usually very mild, but there are high-risk people. Even if you're vaccinated, if you get infected, you still want to inquire about the monoclonal antibody because if you have certain conditions, the vaccines can only do so much under certain circumstances. So I just think it's really important, and what we're going to see is, you're already starting to see, but because you don't have the herd immunity through the vaccinations, you're going to start to see winter and fall waves in the northern states. And we have a summer season, but you're going to see that. And so I think that that's something that should be stressed more and more. And so we've tried to do as best we can. We did an event at Tampa General. We had a roundtable with a bunch of the hospitals talking about what they're doing for monoclonal antibody. But at the end of the day, We have kind of the vaccination on the front end, and then you have the monoclonal antibody on the back end. Most of the other stuff, I know they do remdesivir and some of those other stuff. I'm not sure how much that's really moved the needle. One more.
Governor, the health community is asking for the reinstatement of the dashboard so they can have a daily snapshot as to what's taking place county by county. Will you reinstate it?
Well, I'll talk to the health department about it. I mean, at the end of the day, they do a very thorough report that they put out on Fridays. It's got a lot of information about every indicator that you can have. We did have the CDC, they misreported some cases that they had submitted over the weekend. Basically, they did a 3-day report. CDC put that over 2 days and made it look like we had higher on those days than we did. And so we're trying to figure out if that's been corrected, and if not, whether it would just make more sense to maybe at least put out something. So stay tuned on that. We'll see what happens. Okay, thanks everybody. Great to be here.
We got a question.